Hello Dr. Yuan and my fellow friends. I'm from Group 3 and today I'm going to talk about Implantable Cardioverter Defibrillator, or known as ICD. An ICD is used to treat a dangerously heartbeat. The ICD monitors your heart for very fast and potentially dangerous rhythm disorder. The device implanted just under the skin in the chest area. The ICD is attached to one or two thin-coded wire called lead, which is placed in or on the heart muscle. When an abnormal heart rhythm occurs, the ICD sends shocks to the heart muscle to defibrillator or stop the cycle of rapid twitching, interrupting the pattern of rhythm disorder, allows the heart to resume its normal rhythm. So the ICD is a small battery-powered device that continuously monitors the electrical activity of the heart. It uses electrical pulses or shocks to treat life-threatening arrhythmias that occur in the ventricles, which is located at the heart lowest chambers, and usually inserted under the skin beneath the collarbone and are guided under X-ray to the heart. It consists of pulse generator and wires or leads. The pulse generator contains the battery and a tiny computer, and it's about the size of a pocket watch. And for the wires, it connects the pulse generator to specific location in the heart and can be installed through the blood vessel, eliminating the need for open chest surgery. So how is the ICD is programmed? The doctor or nurse can communicate and program the setting of an ICD specific to your needs and your type of medical problem. To do this, we use an ICD programmer, which is a laptop computer that sends radio waves to talk to the ICD inside your body. The ICD also stores information about what is happening to the device and can send that information back to the programmer by radio waves, so the doctor or nurse can check the ICD regularly. To communicate with the ICD, the nurse will place a plastic disc that is connected to the programmer over the skin area where your ICD is implanted. These radio waves will not harm you. So what are the functions of ICD? It depends on the problem with the heartbeat. The ICD could be programmed for the following therapies. The first one is anti-tachycardia pacing, ATP. The ICD delivers painless, low-energy impulses that pace or stimulate the heart to beat normally, and this can prevent the need for cardioversion or defibrillation. Second, for cardioversion or light shot, if the device detects an irregular rhythm in the ventricles, it will use one or more small electrical shocks to try and restore the heart to a normal rhythm. Third is defibrillation, a stronger shock. The device will switch to high-energy pulses if the ventricles start to quiver rather than contract strongly. The high-energy pulses last only a fraction of a second, but they can be painful. Fourth, backup pacing. The ICD has a backup pacemaker which delivers a low-energy impulse that stimulates the heart to beat normally. And fifth, recording heart activity. The ICD records information about variations in the heart's electrical activity and rhythm, and this information helps the doctor evaluate the heart rhythm problem and, if necessary, reprogram the ICD. So who needs an implantable cardioverter defibrillator or ICD? The ICD are used in children, teens and adults. Your doctor may recommend an ICD if you are at risk for certain types of arrhythmia. ICDs are used to treat life-threatening ventricular arrhythmias, such as those that cause the ventricles to beat too fast or quiver. You may consider at high risk for a ventricular arrhythmia if you have a ventricular arrhythmia before, or you have a heart attack that has damaged your heart's electrical system. The doctors often recommend ICDs for people who have survived sudden cardiac arrest, SCA. They also may recommend them for people who have certain heart conditions that put them at high risk for SCA. Some people who have heart failure may need a CRT device. This device combines a type of pacemaker called a cardiac resynchronization therapy (CRT) device with a defibrillator. CRT device help both ventricles work together. This allows them to do a better job of pumping blood out of the heart.